What's up, everybody? How's it going? Have you guys ever had clicking, popping pain when you're chewing gum, chewing on steak? If so, this is the video for you. TMD, Temperomandibular Disorder. So basically, we're just looking at this little joint right here, and everybody can feel it when they open and close their mouth. So this is your jawbone or your mandibular bone, and then this is your temporal bone or just your skull. And this joint right here is very unique, and it's also one of the most unstable joints in our body. So what happens is when we open our jaw, the first 50% of it is just rotating, and then the next 50% it actually unhinges and slides forward. So it's very unique in that it's got a dual function and it actually unhinges itself. So what happens is we have this disc right here that actually has muscular fibers in it, and when we open our mouth open, that disc slides with this bone right here to make sure that it stays connected. And what can happen is that disc either gets displaced, so we actually have a problem with the joint, or we have muscular imbalance, so we have pull one way or the other. So what it looks like is a lot of people have tracking issues when they open and close their mouth, or they have that clicking, popping. Some people even get headaches, or they get referral pain like into the top of their head, or pain that travels like into their neck. Another reason that we can have some of that jaw pain is actually coming from the upper neck. So that's something that we also take a look at. Some people even get lockjaw, or their jaw just won't open very far. And so that's something that we look at for TMD. We're going to talk about the assessment portion of our TMJ pain or TMD condition of the week that we're doing this week. So first thing we would do, we would ask a patient that would come in with this if they have any history of grinding or clenching. Have they been told by their dentist that they do this, or do they notice that they do it, or do they wake up in the morning and their jaw feels, very tired, like they've been, holding on for dear life all night long. So we would go through that history, and then also trauma. Have we had any, things that have blows to the jaw, or accidents that would disrupt anything like that. But after that, we would go into the actual assessment, what we would call like a movement assessment. So we would just have Whitney open her jaw as wide as she can. Good. And what we're doing is we're watching for deviation or lateral shift one way or the other. And typically we see it on the opening, but we also see it on the close. So we want to see if there's any shifting or like unhinging and then clicking back in. We also feel while she's opening, so we can feel right here, and we can feel that Whitney has a little right deviating when she starts to open, and it shifts back to the left. But she doesn't have any TMJ problems. That doesn't mean anything. I mean, she could go her whole life like this and not have any pain, or she could have pain tomorrow now that we've brought it to the surface. So we're feeling her jaw, and then the other thing is we will have her open her mouth as wide as she can, and we see if we can do the 3-finger test. Can she fit 3 fingers? And that's typically our benchmark to see how wide you can get your jaw to open.
And that's 3 of the patient's fingers.
3 of the patient's fingers. So she passed my 3 fingers, and she passes hers, which everybody knew that she had smaller fingers than me. Anyways, so then we can feel in the muscles, like there's a big muscle that attaches right here, so we're going to feel for any trigger points or balls of muscle or tenderness that may reproduce her pain. So we feel in these muscles. I'm not feeling too much. And then we can even feel up into the temporalis muscle. It's just this fan-like muscle that attaches on the skull and then attaches into the jaw and works on opening and shutting our mouth. So we feel for any trigger points, tenderness that reproduce the pain. We can also feel her upper cervical. The joints in her cervical neck that, you know, they have muscles around them. If they reproduce any of that same pain, then we know that it might not even be a TMJ problem, but it could be an upper cervical problem. So it's a little tight on the left. But yeah, so this is kind of how we would assess somebody's TMJ or TMD. So we showed you some of the screens that we would be doing, and now we're going to show you some of the treatments. So all of our screens really dictate how we treat. So one of the things that we were doing was feeling for trigger points. And I said yesterday that Whitney's left side was good. We can kind of feel one now today. So what we're going to do is we're going to just show you some needling for that masseter muscle right in there. There it is.
Yay.
Yeah. So just take our tiny little needles right here. Just going to pop one right in there.
I love when you say pop.
Good. Good. So we see we got a needle in here. We can try to find that trigger point. Doing all right?
Mm-hmm.
There we go. So we can do multiple needles. So I'll just do 2 more, just kind of show you.
Gotta say, needling in the face is not as bad as I thought it would be.
Yep.
Don't even notice it.
There we go. Good. Alright, and then for fun, we'll just do one that's a temporalis, kind of up in the skull. Because sometimes we can get trigger points up and through here. They're not very common, but they do happen. So, you doing alright?
Mm-hmm.
Good. So, that's kind of some of the soft tissue that we would do. As you can see, trigger points, when we needle them, it just adds a little bit extra blood, tries to get them to relax. So if we have really tight muscles in here from clenching all the time, this is a great time to use it. So we're going to pull these out. Yeah, let's get this one. There we go.
Am I needle free?
You are needle free.
Cool.
Alright. So the other thing that we can do is what we call a lateral pterygoid strip. This one is actually not that fun, and we try not to use it too much because it can be pretty painful for the individual and it can get a little awkward. So I'm going to have Whitney open wide. We're going to get real back in there, and we're just going to kind of just move my pinky back and forth. And we're just kind of stripping this muscle in here. And this muscle causes our jaw to deviate a little bit. It can get a little tight, and so it'll pull a little extra on one side. So what was that?
I felt it like referring, which was weird. So we know he's on a trigger point because I could feel the pain referring somewhere else.
Yep.
So I'm glad it's over.
So that's our soft tissue side of things. So when we do soft tissue, we typically always like to repair or retrain the movement. That teaches those soft tissues that we kind of, worked over a little bit how to work. So like one of the things we'll do with her is we're just going to train her to open her jaw, and she's just going to go until she lateral deviates, and then she's going to go back down. So we can add some like resistive, and then when she tries to close, we can go here, we can push here. Good. So we just try to retrain that pattern, and sometimes we have to dial it back and go to less opening, and just so that we can get that movement pattern and then start to expand from there. And then we just try to teach like resting tone, so that we don't clench so much and that we don't get those muscles overactive. One thing that we did learn in school was how to adjust the jaw. Typically we're not going to do that because it is such an unstable joint, and it can be pretty traumatic if we adjust somebody's jaw at the wrong time. So we learned adjustments where we go here. It's only really indicated when we actually feel like we have, like a displaced disc, or actually need to reset some of that. The other way is if I had gloves on, go here and just quickly distract, trying to get that gapping of that joint. But yeah, so this is kind of some of the treatment we do. We also like to do a lot of soft tissue in the back and the neck. Like I said, a lot of our referral patterns with muscles in our back and our upper cervical refer into the jaw. So we want to make sure that we are treating this whole area and trying to make sure that we're doing everything that we can. So that's how we treat. It's not too aggressive, not too bad. It takes a little bit to retrain, takes a little bit to get those muscles working the way that they should.